senior advisors. And this is a short video I just wanted to create for people to understand how to read these drug reports that come from the Medicare Plan Finder tool. These reports, this video specifically is for someone that would have reached the what's called the Part D coverage gap, or the donut hole is what it used to be referred to. And I'm going to walk you through how to read the report so you understand the costs that are listed throughout here. There's other videos we have out there that explain how we pick the most cost-effective plan out of the 30 different options that are available. But this video is specific to understanding how to read the report if you received a report from us or you're doing this analysis on your own. In this example, the most cost-effective plan happened to be the Mutual of Omaha Value Plan, which has a premium of $24.90 per month and a deductible of $435. So that information is on the first page. On the second page, there's a tier drug cost for if you go to a standard pharmacy for 1 month supply. For each of those tiers, it gives you the price for each of those drugs. But where it gets interesting really is on the third page, where it breaks down your drug cost at the pharmacy that you selected. This person selected CVS and Walgreens, so we're going to look at both of those examples in this report. And with this plan, CVS happens to be a preferred pharmacy, so the copays are going to be lower if you go to CVS with this plan. Now, this person's taking 3 medications. The first 2 are very inexpensive, but the third one is the big cost driver, which is called Restasis. Happens to be a very expensive eye drop. The full retail cost is over $500. So they just list out the full cost of the drug here. Reality is, you're going to pay the deductible plus the copay. If you haven't met the deductible yet for that medication, you're not really going to pay $546 for this particular medication. But after you get the deductible, like the second time you fill the Restasis, is where you're going to pay the cost after deductible, the $28, to refill that Restasis. And then this column also shows, this table also shows you the cost in the coverage gap, which this person's going to happen to reach in August. It's going to be dependent upon your total drug cost for the year as far as when you're going to reach the coverage gap, or if you're going to reach the coverage gap. I have another video out there that explains the coverage gap and the catastrophic and how those pieces all work and when you reach them. So you can watch that if you're interested. But for this person, when they hit the coverage gap, their cost is going to go up to 25% in this example, the full cost of the drug. So it goes up to $136 from a $28 copay. Okay, so the next little section here gives us the total cost for the year. This number right here is the most important cost for the year, because that gives us the premium plus the cost of the drugs. It includes the deductible. It includes the coverage gap. If you reach the coverage gap, it's all in that one number. So that's really the number that we use to pick the drug plan, the lowest overall number for the year. It tells us we're going to meet the deductible in January because of that Restasis, really. And then you're going to enter the coverage gap in August. So that's when you're going to start to pay more for your medication. And then it says you won't exit the coverage gap. So if you had very expensive drugs, which I have another video that explains, you'll actually exit the coverage gap, and you'll get into this cost after coverage gap where you only pay 5% for those expensive medications. All right? But this individual is not going to get past there. So the next chart shows us by month how much their drug costs are going to be. So that first month I mentioned they've got that deductible. So they got to reach that $435 deductible. And then there's the copay, the $28. So you get to that $463 for that first month. And then each month thereafter, you're just paying that $28 copay for that Restasis. The other 2 drugs are 0 copay. And then August is when they reach the donut hole, and they have to pay that 25%. So it goes up to about $140 a month from August through December for their medications. All right. If you add up all of these numbers and you add in the premium of $24.90 per month, that is how you get to that total number of $1,621. All right. So if you're curious how that's calculated, it's the total cost for the year. The drugs plus your premium gives you that total number for the year. All right. And then the next section of this report just goes to the next pharmacy, which is Walgreens. And the report cuts off each page a little bit. So at the bottom of this page, you see the header for Walgreens. And at the top of the next page, you actually see the pricing. You see it's a standard pharmacy, so you can still use it there, but you're going to pay higher copays for your drugs. Instead of $28 a month, it's $47 a month if you use this plan at Walgreens. And then the total for the year is also higher, because it's a higher copay. So it's $1,800 plus for the year for this example. And then it just repeats the monthly cost estimates for the Walgreens. And then everything repeats again for mail order. If you decide to use mail order, it's up to you whether you go to the pharmacy or mail order. But if you use mail order, this next chart shows you what your cost would be for mail order. For each of these drugs, you get a 90-day supply, and it shows you the cost after before deductible is just until you reach the deductible. But then, like the Restasis, it'd be $84 for the 90-day supply. The other two are Tier 1 generics. There's zero copay, even for mail order for a 90-day supply. So the total, if you use mail order, would actually be the lowest out of all three options, very slightly lower than the CVS for this example, just because the 90-day supply is a little bit less for the Restasis. And then it breaks it down for you by quarter with the mail order, since you're not getting the drugs every month. The first quarter would be about $500 for the 90-day supply, and then it would go down to $84, and then you reach the donut hole, so it goes back up to close to $300, and then in October you're fully in the donut hole, where you'd be up to almost $400. But the total, again, the total of those amounts plus the premium would come out to about $1,500 for this example. So there's some other information in this report as well. The new tool doesn't show you the actual quantity limit amounts, so you'd have to contact the plan to get that specific details if there's a concern there. But it does show you if there is a quantity limit potentially for that drug. And then you can verify the dosage and the quantity for each of these drugs to make sure you entered everything correctly, or everything was entered correctly in the report. And then at the bottom here, this part can be a little bit confusing, but it says Part B drugs are not covered. Chemotherapy drugs are not covered by the Part D plan, and that is simply because it's covered by Part B as in boy, not by Part D as in drugs. So if you have a supplement, generally Medicare pays 80%, and then the supplement pays the other 20% for those chemotherapy drugs. All right. There's some other information here, star ratings. This plan is too new to be measured, so there's no star rating in this example. And then there's some contact information for members and non-members. So that's how you read these reports. I hope you found this video helpful. You can subscribe to us on YouTube and get all the updates on Medicare as new changes are occurring. We do post periodically. And I hope you enjoyed this video, and have a great week. Thanks.